We want to welcome all the attendees here for today's session. Before we get started, I want to go over a few housekeeping or logistics before we get started with the session today. A reminder to all attendees that your handouts were sent to each of you via email. So if you did not receive it, make sure you look in your email, or if you can't find it in your regular email, double check your spam folder or your junk folder just in case, because there's a link to the handouts. Also, reminder to all attendees, CEs will be sent out within 10 days to all that attend the entire presentation. So again, a reminder, you have to attend the entire presentation in order to receive your CEs, and those will be coming out to you as well via email. So again, double check within about 10 days, you'll be receiving CEs as well. And a reminder, if you do have any questions, please make sure you use that section that you see on the lower toolbar that shows for question and answer. Please feel free to put in any questions that you have, and we will make sure that we address that. And if we're not able to address it during this session, we'll make sure we do a follow-up to all attendees as it relates to the questions. So I would like to welcome everyone here to today's session, sponsored by ComForCare as well as Pathway Health, as we look at ways that we elevate our workforce and looking at workforce competency, trying to build the expertise across the care continuum here in healthcare today. My name is Lisa Thompson, and I am the moderator for today. I am the Chief Operating Officer at Pathway Health, and I'm very, very pleased to be here with two esteemed colleagues that we have here that will be joining us for today's session. The first colleague that will be speaking today is Dr. Barbara Bowers, and she's Professor Emerita from the University of Wisconsin School of Nursing. Barb is known for her research that has been focused on organizational models of care, particularly cultural change models, staff development, and resident quality of life. Dr. Bowers has collaborated with researchers across many countries and served on local, state, and also federal policy work groups related to long-term care and senior care. She is the founding director of the Center for Aging Research and Education at the University of Wisconsin-Madison, and is also associate editor of the Gerontologist. She has published widely on organizational models of long-term care and workforce development, and she has received numerous awards from the Academy of Nursing and in the Gerontological Society. I'm so sorry, I'm stuck on that today. So we again are very, very pleased to have Dr. Bowers with us today. Also on our panel, our esteemed colleague is Tiffany Robinson, and she works for ComForCare as the training specialist for all the franchise systems. And she's been with ComForCare for over 18 years. With her background in social work, and she is that background from social work, she received a degree at Oakland University and Rochester Hills, Michigan, and also has a certificate in instructional design from the University of Maryland. As a training specialist for ComForCare, she specifically works with onboarding with new offices and helping facilitate their training programs while working with leaders and teams across the nation. So again, we are very, very pleased to have both of those esteemed colleagues here with us today as we look at workforce competency and the needs here in the United States. So again, we have some specific course objectives here that we are looking at in our session today, and I am very excited because both of our colleagues will be addressing those objectives that we have here today, because we know healthcare is evolving and that landscape continues to evolve. Aging services professionals recognize that ensuring a competent and confident workforce is really essential to delivering high quality care. So our session today will explore strategies for building and maintaining expertise across this overall care continuum, from home care to skilled nursing and beyond. Also today, you'll gain some insights to effective training programs, competency-based education, and nurse residency programs, as well as leadership strategies that empower caregivers to provide excellent care. And we know that by focusing on skill development, knowledge retention, and really interdisciplinary collaboration, Organizations such as your organization can enhance quality care and improve client outcomes and support workforce retention by learning some of these strategies that we discussed today. So let's take a look at what the need is and then really spend some time focusing on specific competency needs to build the expertise and leadership and looking at those implementation strategies that are utilizing really a collaborative approach for success. So when we look at healthcare today, we know that life expectancy and the aging population continues to increase across the United States. A fun fact, but also an alarming fact as we look here at that we see research is showing that 589% increase from 1950 to 2025 with our aging population. So we know that there's a specific need for workforce. And I know all of us that are here on the call here today are really focusing in on how we take our workforce today and how we increase that really those needs and increase the competency of our workforce here because we know the rise in the need of services for aging services is going to continue exponentially across the United States. When we look at that as well, we know that that perspective, when we're looking at that aging workforce, is that we're going to see continued increase in acuity and complexities. And as you see here, as we're looking at not only is there the aging demographics, but we see then that increase in the acuity and multiple comorbidities or chronic diseases that individuals that we're serving in our different settings. If you're in skilled nursing, we're going to see and continue to see higher acuity and more medically complex as well as behaviorally complex individuals in those settings. If you're in assisted living or home and community-based services, you will continue to see that increased acuity as well as consumer demands to look at having the right care in the right place at the right time. And then you couple that with the aging population is that we will continue to see an advancement and continue to see an increased number of individuals with terminal illness. And then you couple that with the stretches that we have in our current healthcare environment is that we are starting to see younger population with those specific needs coming into our settings. So again, the need for increased competencies and enhancing the expertise in our workforce will continue. Because how do we build that expertise? We look at those changing needs of really the demographics that we're serving. And we're also looking at the changing needs of the workforce that we have that are going to be here not only today, but also helping us serve the population as the need continues. Also then with that is that we have to looking at defining what workforce competency is, what those specific qualities, those skills, those abilities, and the capabilities that those individuals that are part of our workforce, what they will need in order to better serve the residents or the clients or the customers that we're serving based upon the setting types that we have. And with that, then, when we identify those gaps in the competency needs, we have to look at our training programs and how we develop our staff in order to continue to advance the workforce and the expertise of our workforce to meet those growing demands. And then when we do that and we wrap that all together, is that it really looks at how leaders take all of those specific needs and competency programs and education and training programs and identifying those needs and the skill levels that we need, how we then take it from a leadership perspective and implement strategies so that we have truly a collaborative approach to move forward in healthcare. So let's look at how we look and define and look at how we enhance knowledge and skills and abilities of our expertise of the healthcare workforce that aligns really with the changing demographics that we are all incorporating and looking at today. Competency is a term that is not new. However, it is needed today with increased acuity and multiple comorbidities in our settings. So, Barb, can you walk us through what is competence and some things that leaders need to understand and consider as they prepare their team for really these enhanced needs and skills to be able to really support the changing demographics that we see in our settings?
Yeah, thanks, Lisa. This is a really important issue. Competence, what does it mean, and how do we create it? How do we develop a staff that is competent to do the work that they're being asked to do? I'd like to start with a distinction. We talk often about training programs, and I think even bear with me, it's not just a language issue. I think when we talk about training, the focus is really on the product that you put together, the materials you take, whether it's a video or a PowerPoint presentation. The focus is on the teacher. And so I think it's quite easy to think about, have I put together a good presentation? Does it have nice graphics? Is it understandable? Have I been comprehensive? None of those questions actually address learning. And so there's not a necessary direct relationship. So you can give people a lot of information, you can give them a video, but whether or not they actually learn is another question. And so if you look at learning, if you talk about learning instead of a training, it really puts the focus back on what's the experience of the person who is receiving whatever it is that's being offered there. What are they actually gaining? What do they understand that's new? And, do they have the skill? Do they have the knowledge? Those are training and learning. But I think when you talk about competence, you've got to go quite a bit further. So competence is not just, do I did I gain the knowledge? Do I understand the knowledge? Can I even demonstrate it and feed it back to you? It's really about, am I going to be able to use this in practice? And that translation into practice is not automatic. So you could know something and not be able to apply it. I'm sure we've all seen that. You go to a course, you learn something, and then you don't see people actually doing it in practice. So this is a really important distinction. Um, some of the things that when you're competent, you build on that knowledge and the skill, but you also consider options. It's a very active process where you're thinking about what are all the possibilities here. Am I able to apply it appropriately in the right context? Do I understand how context influences the way I use something? And the ability, really important to be able to evaluate what you have just done and whether or not it's been effective. So those are really different things. And I think it suggests that you put together an educational program, a model that's quite different from the usual process of training. So let me go on to talk a little bit about what I think the components of competence are. There's no agreement, by the way, on what competence is. If you read 10 articles, you get 10 slightly different versions of what competence is. It's obviously skills, tasks, knowledge. People need to do that. It also, I think there's several other things that are there involved. One, it suggests that you're current. You can't be competent if you're practicing um, something that was current 10 years ago but isn't any longer. So that implies some active gaining information. So obviously it's part of that. It's also the ability to look at, you see something in front of you and you can generate the possibilities. So what are all the possible things that I'm seeing here? This person is perspiring. Does that mean the room's too hot? Does it mean they're having some sort of cardiac episode? Is there something else going on? So it's the ability to observe something and generate a number of hypotheses about what might be going on. It also requires confidence. And it's one of the things I'll talk about a little bit later. Confidence is in short supply with new grads in particular. Um, I've never met a new grad who felt competent or was confident in their work. Um, Hospitals have been doing residency programs for decades, knowing that there's a long way between graduating someone and having them feel confident in what they're doing. And if you're not confident, you don't practice competently. They're really quite closely tied. Um, so I think what I hear from people often is these new people don't have any clinical judgment. Of course they don't. Clinical judgment requires experience. And so another part of competence is the ability to have good clinical judgment. It requires practice. It requires a supportive environment. So if people don't come to you with great clinical judgment because they're fairly new at it, they need an opportunity to practice. They need to practice in a supportive environment. They need to gain experience and have the ability to reflect on that experience with someone who's more competent. That to me suggests that everybody needs a mentor. And I think that's sort of the new wisdom here. It's not actually so new, but it's really caught on in that new, especially new grads absolutely need a mentor who knows how to mentor, who knows how to coach, who knows how to sort of raise the young, um, and provide them with the confidence that they need. I think a couple other things that are not often talked about in competence, but I'm going to add them in because I think they're really important, is the ability to collaborate, to know who you collaborate with, who needs the information or the insights that you have, who has information that you need, how do you share it? Do you have opportunities to share it in a respectful way? Um, there are very few organizations that really operate effectively in a team model. This has been looked, there's a number of research studies that have looked at this, and I think the latest I saw was about 8 to 10% of skilled facilities. I don't know about other settings. Haven't seen any research on that, but actually are practicing in a team model. Everybody calls themselves a team, but they don't actually function as a team. They don't do a lot of sharing. There's not a lot of connection of information back and forth. I think one good example that I hear all the time is CNAs are rarely at um, care planning meetings because they don't have time. They can't leave the floor because there are things to do, but there's really important information that's not gained. And I've done a lot of work with CNAs, and I can tell you they have a lot of information that the nurses should have, but it's not generally passed on for a whole host of reasons, which is probably another topic. I think the last thing that I would add here, which I haven't seen a lot in other definitions of competence, other components, but the ability to shift perspectives, to not just, it's sort of like the difference in training and competence. It's not just a matter of, um, I know this, it's like, how do you experience this? How do my peers experience this? How does the resident experience this? It's fundamental to person-centered care, but it's also the ability to understand your coworkers when they're struggling with something, who's particularly skilled at something, but to understand the experience, particularly of new workers. I think all of these things make for someone being a really competent worker in long-term care. Say a little bit about clinical judgment, and I want you to think about your staff development programs and whether or not they align with this. So, clinical judgment, in addition to being based on experience, it means you need to recognize cues quickly. You need to be able to analyze the cues. What are the possible things this could be? And to prioritize it. What are the most likely things? And that brings in a whole other set of information, generating and weighing the possibilities, taking an appropriate action. And a really important component, which you always see in competence and clinical judgment, is being able to evaluate my own work. What I did, did it work? Do I need to do something different? And adapting based on that evaluation of whether or not your action actually led to the outcome that you were hoping for, and has to be evidence-based. Um, Collaboration. I talked a little bit about this already, but teamwork, as I said, requires sharing information and hearing all voices, which means creating opportunities. People have done this in lots of different ways. Huddles in the morning where everybody is included, not just a few people. Care planning meetings where actually everybody is included, and the the context, the environment is created in such a way that people are not afraid to speak up. There's a lot of information out there that people are not getting that they should be having. Important that everybody understands their role, what's expected of them. Conflicts between staff are resolved quickly. Everybody knows how to do that and is committed to doing it. There is clarity on not just the goal of the team, but what everyone's individual contributions are. And as I said before, it includes all staff. This is pretty rare, no matter what the setting. So very few settings do this. I think it's a particular challenge for assisted living and home care, where it's much less likely that people are in the same place. The objections to this are it takes time, don't really have time to do that. You lose so much by not doing it, and it actually doesn't take a lot of time. If anybody here has experience of doing a lot of huddles, or other ways of creating a real working team. It does take a little bit of time, but can actually be done fairly quickly. And once people get used to that sharing, it proceeds pretty automatically.
And Barb, I
So,
have a question
yeah,
real quick for you as it
sure.
relates to collaboration. Are
Yeah.
you seeing, like, looking at research and working with organizations across the country, the ability to leverage technology and virtual environments as well with this to help with work?
In terms of teamwork?
In collaboration, yes.
Yeah. Um, there isn't a lot of it. There certainly is some. I know one of the things I was going to talk about a bit later was was evaluating someone's competence virtually, and there is more and more of that being done. Um, Less collaboration. I think where I've seen it most problematic is in home care settings where home care aides in particular feel very disconnected. Um, and having an electronic charting is not, doesn't actually make people feel connected. It
Hmm.
needs to be much more um, a virtual, like even like a Zoom. I know that's used more than obviously than it used to be, but I think we need to take advantage of that more than we do now, because sort of in the moment exchange of ideas is can't be replaced by something that's not real time. And I still a lot of programs collaborate through things that are not real time, so it's not a real exchange. Um, so I guess
Thank
that would
you.
be my um,
Thank you.
experience with that. Yeah. So uh, the next thing that I think, as I talked a little bit about already, is the shifting of perspective. And this is, I know that there's a subsequent session on person-centered care. This is absolutely fundamental to person-centered care. Um, if you can't shift perspective, there's no way you can understand, or don't even give yourself um, the expectation of understanding what somebody's experiencing. I ran into something the other day which kind of I think is an example of this, and I'm sure everybody can think of some examples. So this was in a home where there are a lot of bariatric patients, and so obviously there's a lot of use of lifts. And so I was talking to residents who said they were absolutely terrified of the lift and have been refusing to get up because they're afraid of the lifts. And the
Mhm.
reason they're probing a little bit more, the reason they're afraid of the lifts is because they're watching the CNAs who are clearly uncomfortable with the lifts, lack some confidence, not quite sure of how to use the lifts, even though they have all been trained and passed off on the training. The challenge came when well, this isn't exactly the context that I had to demonstrate using this lift. This is a little bit different. The person is different. They're larger, or they're at a different angle, or the room is quite restrictive, so I can't really get it around where I want to get it to. But the administrator assured me that everyone was competent with the lifts because they'd all been checked off. They'd all done a return demonstration of how to use a lift with a bariatric patient. So that's a nice example of how shifting perspective really requires you to sort of delve into the experience of the other person in order to really know. So this is all part of, I think, good competence and good clinical judgment.
And
So,
thank you. Yeah,
yeah.
thank you, Barb, for looking at that. And thank you for giving us that overview of looking at competence and really looking at overall clinical judgment. And I would really like to take this conversation a little bit further and have you spend some moments on really how we take learning or our training and how we put it into action in our different settings that we have.
Yeah. So as I said before, knowing something and even knowing how to do it, being able to demonstrate it doesn't mean you can use it on the job. And so there's also a real gap there in terms of what we think people are doing as the administrator I just talked about, and what people are able to do or feel confident doing. This is called the transfer problem, and it's something that educators in many environments have been looking at for decades. So go to the next slide. This is a little bit dated because I haven't seen anything more recent than this, but the latest work that was done in terms of taking an educational program, staff development program in a long-term care setting, people passing the tests, being able to demonstrate, what researchers have found is that about 40% of what should be used in practice is ever used at all. So it's sort of immediate efforts to try and, I learned something new, I'm going to try and do this in practice. About 40% of what could be transferred is people actually try to do. If you look 3 months later, um, you're at about 15 to 25%. And if you look long term, which is 6 months, which isn't actually really long term, the best that anybody's been able to find is about 10%. Now, just if you look at the wasted time and money in that, where so much of the education, the sincere efforts to improve on everybody's part, the teachers and the learners, not much of it is left at the end of that. And the other thing is, that's important is that people, once that happens to people, they stop actually trying. They lose interest in education because it's like, what's the point? We're not actually going to be able to use it. So what are some influences on whether or not people are able to use what they've learned and to use it in practice? Um, I say right off the bat that the most important influence is the direct supervisor. Does that supervisor support the person's learning? Does the supervisor help the person transfer that knowledge to practice? Because what often happens is you learn a new skill or you learn something and you try it and it doesn't work so well the first time. The situation's a little bit different. I mean, even using the lift example, I was able to do it here and then I tried it with this person, a little different situation, and it didn't work. Now I get really frustrated and I'm just going to throw it out. So what's really important is if there is a person there, a supervisor, or even a peer in some instances who can say, well, wait a minute, it didn't work so well, but let's see if we can try it a little bit differently. We'll have to adapt it a little bit. That motivation to keep going is really important and almost entirely dependent on the environment being supportive. Otherwise, people just abandon it and that's the end of it. Peer support is also really important so that peers are prepared that someone is coming back and learning something new. If it's a new thing for the organization, you often hear peers say, that isn't the way we do it, so we're not going to do it that way. So there needs to be some preparation of the staff where something is, especially if it's CNAs or nurses, so that peers can feel more supportive. So that again is up to supervisors in the environment, up to the leadership in the program. Okay, so I think with that, one of the things I want to say, I know this isn't really so much about staff developing competence, although it is about supervisors who are as hopefully as clear, are just so vital in the environment. So what do we know about skilled supervisors? And this is all from the perspective of the people being supervised. So what do they say? Well, they coach and mentor. They don't just tell us, they coach us. And so that means working with us to improve something, not just telling us how to do it. They're approachable. They're not scary. They're good role models. They do it well. When they criticize me and people say, I want to know when I'm doing something wrong, but they do it constructively in a way that's not embarrassing, that doesn't humiliate me in front of peers. Um, and that makes me not feel stupid. That makes me feel like, okay, I got some of it right. Let's work on the rest of it. Someone who communicates clearly, has a positive attitude, and finds, this is really important, finds practice opportunities for me to learn new things, and then watches and gives me feedback on that, clarifies expectations, and tells me what I'm good at, not just what I'm not so good at. So those are really important. Um, this is the part of transferring learning into the practice setting, which is if they're not going to learn it, use it in the practice setting, I don't know what the point is of learning it in the first place. So again, the supervisor is vital to allow this to happen.
And you're right, Barb, as we look at all of this and the great insight that you gave us looking at really building that strong transfer climate in an organization is really key to building the expertise and the competence within our workforce and looking at the different ways of really how we assess and we promote the competence. So if you would take a few moments, and I would love if you would share some of your thoughts and ideas on truly how to assess and promote competence in our workforce and across our different continuums today.
Yep, great. So I think we have some very traditional ways of assessing competence, things that we're all familiar with. We do quizzes, we do exams, we ask people to demonstrate, um, give feedback on and give them feedback on their demonstrations. These are traditional ways of doing it. This doesn't actually give us any information on how people are putting the pieces together, how they're able to do things in the practice setting. So I can almost hear people saying, well, I don't have time to do this. But I think, again, bear with me because the returns are going to give you a lot more than the time invested up front. So assessing competence generally requires you to have access to how the person is thinking, to how they think through an issue, a challenge, a problem, something they see and they have to make a decision about. The most effective way to do that is either in the practice setting or through case studies. And that allows you to say, okay, here's an example of something. Now, think through how you would approach this. It's also a nice way of actually developing some skill because you can give people feedback in the process. But if you're simply assessing to give someone a clinical situation and say, talk to me about how you would approach this situation. What are you thinking about? What are the possibilities and how are you making decisions? That's the best way to assess competence. And unless it's just all you're looking at is competence to actually perform a skill. But this is really more about clinical judgment. And if you want to assess competence, you've got to do it through think aloud. What's the person thinking about? Another important way to assess is to observe people, have them explain to you what they've done, and give them feedback. And again, that's also a way not just of assessing, but of promoting growth. Peer feedback is something that's rarely used, but is quite effective. And there's lots of situations where peers are pretty good at something. Maybe someone is an experienced CNA or nurse, or personal care worker even, and they're training a new person to have the peer give the person direct feedback on what they're doing is very different from getting it from a supervisor. And they'll look at different things than the supervisor does. Part of it is the effect on other workers that the supervisor isn't necessarily going to be even thinking about. Um, Self-assessment, which also helps build confidence. But a self-assessment where people can reflect and then talk about what they've learned. Again, all of these things that are really effective are interactional. The things that where people sit in our sort of like buckets ready to fill simply don't work in terms of staff development. And all these things can be used together. So those are some of the most effective ways of doing it. And there a number of places, especially home care, have developed virtual methods for doing this. So I think just one more thing I wanted to say about assessments, and that is that it, it, it depends partly on the purpose. So are you assessing someone to be ready to perform the skill? Someone is going to be doing Foley catheter insertions. You want to just know, can they do it competently? Which is not about the clinical judgment about when it's needed or how you problem solve something. It's simply, are they ready to perform this skill? That's one. So a demonstration works really well there with a think aloud about what are they thinking? What are the challenges they might run into? Why did they just do something that they did? Testing. Um, and I think this actually leads to, or you can actually use assessments to say, how are we going to go on to the next level of expertise? This is, I've assessed you now at this level. And so if you want to grow, if you want to develop, then this is the next level that you need to reach. Timing is important. Are you doing it? If you're going to use a case study, You might want to do something before implementation, have someone think through it if you're doing it in the actual practice setting, and then have them do a debrief afterwards. So following implementation or a demonstration, or in response to problems. Um, and finally, you need a skilled mentor to be doing this. What you don't want is someone barking at the person who's trying to learn something or to demonstrate something. Support and productive feedback. I know I've said that probably too many times, but it is so fundamental to people being able to progress. So let me say a few words about virtual assessments, because I know a lot of places, whether it's assisted living or home care in particular, are in a situation where the person doing the assessment is simply not in the same place as the person who's being assessed. People have used telephones, virtual meetings, simulations, even body cams. I was reading a study recently about a home care agency that uses body cams to do assessment, where they actually observe what the person is doing. Don't think there's a lot of that, but certainly is some. Can watch real care situations, simulations, or case studies can all serve for a virtual assessment. So it could be that you're actually with the body cam watching the real clinical situation and doing an assessment, having the person talk through that might be uncomfortable, especially for the patient. Simulations also help in terms of simulating a situation. And then again, always talking through what you're doing, and the same with case studies. Um, so also best uses. What's the best way to add? I mean, one way the body cams have been used is where staff in the home care setting have been challenged with something. They're having a difficult time with something and they really need some help. And so they can use that, whether it's a Zoom or a body cam, to help adapt to an actual clinical situation. Um, Solving any kind of problem. So those are really help. And also virtual assessments or virtual connections are quite helpful with teamwork. I mean, to put the whole team on virtually. I know some places that have done this. The team is sort of scattered, especially in home care, that's an issue. So there's a time when they all get together on a Zoom call and actually talk about what they're doing, and can do a fair amount of assessing of each other. So that's another, I think there's more and more of that happening. And in every case, I think the think aloud demonstration and then a discussion of what you hear, what the person does in terms of thinking aloud, vital.
So, Barb, I know you've outlined the importance of competency and really looking at competency processes, how to assess learning and putting training into practice, the transfer, that whole area that you talked about, and how to assess competence. And all of this really, truly, we all know, directly impacts retention of our workforce. And you've done extensive study in this area, and I know we could spend much more time on retention. However, I would love for you to provide a quick high-level overview on a few key points related to retention, especially what's impacting our direct care workers as well as our licensed professionals.
Yep, great. I do want to emphasize one thing Lisa said, which is that competency and developing supportive development of competency actually is a retention strategy. If you realize, and I'm sure people are probably aware of this, although you might not think about it a lot, that for the first year, nurses are really lacking in confidence. And that's also true of direct care workers as they start out. They feel unprepared. Um, they worry about being progressed in terms of responsibility too quickly, um, often don't feel welcomed, and we know pay and benefits is another reason why people leave. So these are some of the major reasons: not feeling supported, lacking confidence, not feeling prepared for the work. And I can tell you as an educator that nobody leaves an undergraduate program, and I know CNAs, it's the same thing, are not really prepared to work in this environment. So how do you retain people? Well, mentors and coaches are a huge draw. They have a huge impact on whether or not people stay in the job. And I always say this because I think it's important. When people leave a job because they experienced a real trauma from not being confident, making mistakes, they often leave the profession. So we can't really afford this now. We need to retain workers. There's not a lot out there to draw, and I think the efforts really need to focus on retention as opposed to recruitment because there's not a lot of people to recruit at the moment. Um, Recognition, and this isn't recognition necessarily for achievements, although it's important. It's a recognition of how challenging the work is, of saying, I know this is tough, you're doing a great job. Really important. And I think one thing I always tell leaders is I've been impressed talking to CNAs, PCWs, nurses, how important it is for leaders in an organization to recognize that people are challenged, that this is tough work, it's great work, but it's hard work, and you're doing okay. So coming from leadership is really important. And all of these things lead to developing confidence, feeling prepared. And the other thing that's really important to remember is not to push new people to do things that they don't feel confident or prepared to do, because they'll leave. So with experienced nurses, and this isn't so much about competence and training, but I just thought I would throw this in because I think it's important to look at some of the differences between early career and later career nurses and why they leave. So later career nurses leave because they don't feel like they can provide the care that they know residents need. They don't feel good about the care they're providing. They feel a loss of connection to residents. So that's a bit of a challenge when people are in positions where they have minimal connection to residents. Find ways to help people have an opportunity to connect back. That's why they went into the profession, and that's how you can keep them, help keep them. A lack of opportunities for developing competence and expertise in areas of interest. Not involved in organizational level decisions. People who've been there a long time feel like they have a lot to offer, they want to contribute, and they should be involved in decisions. Everybody knows about the work-life balance problem. One I've heard about recently, a lot more than in the past, is when someone is promoted to administrative role, they're not really leaving behind other responsibilities, and so they kind of end up with two jobs and people get totally burned out. And then paying benefits, which is never top of the list. So when people feel good about the care they can provide, they have opportunities for professional growth, they feel like they're making a contribution to the organization. Part of a team, actually being part of a real working team really is a great retention strategy. The culture is positive, and I just wanted to say a word about stay interviews. We all talk about exit interviews. That's sort of too late. Stay interviews are interviews where you routinely meet with especially your longer term staff, not just longer term, but don't leave them. Don't just assume people are going to stay because they've been there a while. Sit down and talk to people. The DON is often a good person to do it. What's important to you? What would you like to develop on? How can we help you feel better here? And often they want to have a bit more of a role in decision making. They want to develop expertise in dementia or something else. And so this is a way to find out what's important to this person, how you can help them stay rather than why they're leaving. So direct care workers, a little bit different issue. Direct care workers leave because they don't feel respected by the staff, supervising staff. Their schedule is difficult and they have no control over it. Not enough staff. The supervisor is more of a disciplinarian than a support. They don't feel prepared. I'm not going to usually speak out and say this. A lack of opportunity to do something interesting, whether it's career ladders or learning something new. When other people leave, turnover of uh, leadership or peers, and any kind of organizational churn where it seems chaotic or disrupted. Retention strategies with direct care workers, it's similar to nurses. Feel good about the care that they can provide, feel like they can make decisions and they have the skill and the knowledge and the support to make decisions, opportunities to learn, feeling respected, and that there is continuity among the staff, so lack of turnover. So there's a fair amount of overlap across these different groups. So
Absolutely. And Barb, can you just spend just a few minutes and then we'll be moving on to Tiffany,
yeah,
but looking at some models that really promote that learning and retention that are out there.
yeah, we could do a whole session on this, but I think
Yes.
right, I think the baseline is active learning, where the individuals who are learning are actively engaged in the process, not just recipients sitting there hearing something. Peer-to-peer education is really, really important. It makes both the giver and the receiver feel really good. So find expertise in your staff at whatever level. Have them be teachers to the other staff who are in similar positions. Formative assessments, which is an assessment that's used in order to promote growth, not to find out what you're doing wrong. Um, Debriefing and self-reflection. I talked about this in terms of thinking out loud, letting other people enter your thinking, listening to your own thinking. Sometimes when we think out loud, we listen to ourselves and we say, wow, why did I do that? Um, I think greater use of virtual technology and lastly, nurse residency programs. I think a more robust orientation for everybody is in order. Home care actually does better than anybody on this, but I think we have a long way to go on making people feel like part of the organization and supporting them. And I think so. I know one of the things that I was involved in developing is GeriRes, which is a nurse residency program for LPNs, RNs in skilled nursing and assisted living, which has actually led to greater retention in staff who feel like the organization is invested in me, supporting me. I'm feeling better prepared. So I guess I think these are the models that work. There's not a single thing, a warm environment, chances to evolve, feeling good about the care you give. All of these things are important and lead to people feeling competent and confident.
And thank you, Barb. I mean, these are keen insights that we were talking about here as we look at ways that we can elevate our staff and increase the expertise with competency, professional development, and finding ways that we look at learning and putting that training into practice. And it's been wonderful information for us to consider here. And what I was thinking here, Tiffany, as I was wondering if you would provide us, because you are working with organizations across the country and promote training and work through, and as a training specialist for your organization, could you tell us some of the leadership practices and approaches that you've used and that you put into practice that have really fostered a culture of continuous learning, that collaboration, and also the accountability in the different environments and settings that you know? Because I know you have many set strategies that have really been very successful.
Absolutely. So, fostering a culture of continuous learning, collaboration, and accountability. Our number one goal when it comes to training is enhancing our professional staff skills while improving the quality of care for clients. We want to promote staff and client safety, comply with regulations, and attract and retain quality staff members. So, why does having a comprehensive training plan matter? Training provides employees with the skills they need to provide quality professional care. Employees who receive regular training are more likely to feel supported and engaged in their roles. They're also more likely to be more satisfied and comfortable with their position. Training plays a vital role in the healthcare industry, and it's not just meeting the requirements. It makes sure that employees are well equipped to provide top quality care. It helps employees feel supported and engaged in their roles and can actually help reduce staff burnout and turnover. Training can encourage career development and advancement opportunities. Added training and education can encourage a higher interest in learning, and interest in learning can then lead to career advancement. For example, having a caregiver now pursue a nursing job. Training can aid in stress relief and management. Employees who feel well prepared and supported in their roles can have lower levels of stress. And training can lead to improved satisfaction of clients as they're receiving consistent quality care. The more knowledge, skills, and experience your employees have, the higher likelihood for their productivity and effectiveness in the care that they provide. So, the first thing to think about in regards to a training program and a training plan is to think about not only providing initial training to new hires, but also to provide ongoing training on at least an annual basis. It's always important to touch back on important topics and provide re education as needed. We want to make sure we provide the valuable training and support to our staff so they feel comfortable and confident providing care, especially as we're working in an environment where the client's needs and condition can change quickly. As you create your training plan, make sure you have clear goals. The first of those is to make sure we include all compliance requirements. Of course, looking on as a state and a federal level, as well as CDC guidelines and any other guidelines you may be required to follow in your organization. On top of hitting all of the required content, you also have to consider what content you want to include that may not be required, but it will really add to the goals of your training program. Your employees need to have a plan. They need to have tools. They need to have interventions that can have a higher level of success in the care that they are providing. You also want to communicate your training plan to your team and staff and make sure that you encourage communication and questions to be brought to your training lead. Regularly look at your training plan and adjust, add, remove items as needed to ensure you are constantly hitting the goal on the training you are looking to provide. Do not be afraid to ask for employee feedback as you what do we need to adjust? What do we need to provide to fully meet the needs of our staff? Are there items that are missing? Are there topics we're spending too much time on? Is the information presented in a digestible format? Feedback is key to building a program that's meaningful and successful. We want to make sure we are proactive in our training planning. We do not want to constantly be reacting to situations. We want to try to anticipate the tools and the interventions that the team will need. I encourage that we're always trying to take a proactive approach to training. It's much easier to provide training ahead of time versus responding to an issue and feeling as though you're very quickly and very reactively adding new training due to a missing link in your previous training. Now, let's talk about ongoing surveillance. Many of us, using home care as an example here, we're already checking in for reassessments and supervisory visits. Make sure you're taking advantage of seeing your professional staff members in action. Are they following protocols? If not, let's use this as a teachable moment. Provide on-the-spot training. Coach your team by example. Show them the proper techniques if needed, keeping the lines of communication open and encouraging them to reach out with concerns. Be available, respond quickly to staff training questions and concern, always keeping those lines of communication open, especially while we work with clients whose conditions can change quickly. Eyes and ears must be consistently focusing on the client condition. Let's move to the next slide and discuss a little bit about training implementation. The biggest part of a training program should be that the program is tailored to the needs of the staff and their clients. Different training methods that you may use, instructor-led, in-person training, think traditional in-person training, e-learning. Do not be afraid to venture into the virtual world. E-learning can have huge benefits for your team. It allows training to be provided at the caregiver's fingertips. It can be available to them 24 hours a day. You can also add benefits such as gamification to your training, which adds small gaming elements to your training which can encourage engagement and motivate caregivers with friendly competition. Blended learning. This takes in-person training and virtual training and puts them together. Let's present some topics in person while allowing other topics to be covered in a virtual element. Coaching. This allows a more personalized approach to training with a one-on-one focus. Role playing. This allows your team to practice skills on one another in a low-stress environment. Job shadowing. This allows your team to see a more skilled or experienced staff member perform the skills and learn from seeing the skills performed in person. These are only some of the many methods you can use in training. I recommend that you try different methods and challenge yourself to find the best fit for your team. So now, managing training success for the long term. Be ready to adjust and update training plans, not only to meet updated state, federal, CDC requirements, but also to meet the needs of your organization. Train your trainers. Training is always evolving, and trainers must be lifelong learners. We need to stay on top of new findings, methods, what's new in our industry. Take time as a trainer to attend conferences, stay on top of studies and new findings. Tips for training leader success, of course, be that lifelong learner, have a commitment to development and improvement. Be open to learning. Sometimes as a person who's been in a role or in an industry for years, we feel that we already know it all. We have to be open to what we don't know yet. Be adaptable. If one method isn't working, try something else. Be open to different learning styles and methods. We have to be open to new ideas. We also have to be open to technology as it evolves and offers us new solutions for training. We want to make sure that we respect our audience. I love training as much as the next trainer, but we cannot disrespect our audience by giving them too much information or training and not respecting their time. What is the right amount? What are we required to provide? And then what is the amount that clearly provides the information in a digestible way? We have to look at the needs of our audience and their challenges. If you have staff members struggling with the way that you are providing training, consider offering a separate training session for those struggling. Do they need a job shadowing session? Do they need some coaching through a particular skill? You want to make sure you're an effective communicator. Use clear language to build rapport with your team. Encourage continuous learning. Express excitement when your team finishes training. Consider offering a small token of appreciation when training is completed on time or if optional training is completed. And finally, do not be afraid to repeat training. Sometimes we need to see the content annually. Reminders on skills can be helpful. Go ahead to the next slide. I now just want to share an example of a training plan in action. The example today, we're looking at a home care agency providing supplemental staffing for an assisted living facility. As many assisted living facilities, many of the residents are individuals who are regarded as a fall risk. The community wanted to make sure that each and every caregiver entering the building had training on fall risk management. To meet this need, we looked into our library of courses on our learning management system, and we found a well-rounded curriculum of courses to help each caregiver have basic knowledge walking into the community to provide care. This included courses on utilizing home safety checklist into the community, looking at environmental risks such as poor lighting and other hazards such as non-essential furniture. The training was provided virtually at the caregiver's pace, requiring that the training was completed before they started work in the facility. In addition to the online coursework, we also had our nurse manager provide pop-in visits to ensure caregivers were providing adequate care and that these caregivers felt comfortable in the care they were providing. If a caregiver had questions or needed guidance, we would provide them with on-the-job support by having our nurse manager or lead caregiver show them the proper techniques and skills, and then having them show the skills learned in a teach back program. We also regularly asked our caregivers, clients, the families, as well as the building management for feedback. One other item that we realized is this particular facility had recently had some budget cuts. One of those items was their exercise program. We decided that we would go ahead and provide an exercise program on site with our staff. We utilized exercises such as the CDC recommended chair rises as a simple way to help these residents gain strength. We also put together workshops for clients and family members to attend that highlighted fall risk and ways to promote their loved ones' independence just by having smarter practices in their apartments. For example, we touched on footwear, use of assistive devices, and hazards in their homes, such as extra furniture that can pose a fall risk. This office has now had a 3+ year relationship with this assisted living and really credits their commitment to training not only their caregivers, but also training the clients and their families on fall risk as to why they still have that relationship. All right, Lisa, Dr. Bowers, I'm going to go ahead and pass the group back over to you.
Well, Tiffany, I again thank you. That was some great insight and a wonderful example to explain to us how you put that training and the competency and put that training into practice and to action. And as we know here, as we know today, all of us that are here on this call, is we know that the demand and the need is going to continue to increase for the populations that we serve. And with today, hopefully we've all learned a few key tidbits and strategies for looking at how we can increase skills and looking at competencies, leveraging out some of those evidence-based training models that are out there, and knowing that spending that time and that energy on our supervisors, as well as our direct care staff and all of our staff in our settings, professional development works. And it is a retention strategy, a #1 retention strategy. But the most important thing is professional development will help and guide and aid into good quality outcomes. And also, Tiffany, you shared some wonderful leadership and really collaborative environment and type of strategies to use as we move forward here, and showing that how we can look at designing and working with our workforce to really elevate our workforce competency today and elevating that expertise. So I want to thank Dr. Bowers and I want to thank Tiffany. Again, thank you all for joining us today. And again, Dr. Bowers and Tiffany, thank you for your keen insight, your expertise and knowledge to really helping us and guiding us as we look at ways that all of us as leaders, providers, and professionals, how we elevate our workforce competency today. The need is there, the growing demand is there. And you know what? I cannot thank each and everyone that is here in attendance for all the great care and services that you provide those individuals that are entrusting their lives to us every single day. So thank you for spending time with us today, and I hope you received a few tidbits of knowledge and some strategies to help you as we move forward. Thank you for joining us.